Clinical Psychology Studies, Interviewing to Study Schizophrenia, Goldstein, 1988. Aim: to see if there is any significant difference in the age of onset of schizophrenia between the two sexes. To see if women have a less severe course of the disorder than men. Prior to her study, Goldstein looked at 21 longitudinal studies, and all but one showed that women with schizophrenia experienced fewer rehospitalizations, shorter hospital stays, better social functioning, and less severe outcomes. Method: longitudinal study. Procedure: sample consisted of 199 men and women. All had been diagnosed with schizophrenia in the 1970s on admittance and on discharge from psychiatric hospitals where they had stayed for less than 6 months. All are expected to live with a family member, either a parent or spouse, and all were aged between 18 and 45. None of them had any organic brain disorder such as epilepsy, and none had any drug problem including alcohol abuse. They were re-diagnosed 10 years later using the revised version of the DSM-3. Of the original 199 patients, 169 were re-diagnosed with schizophrenia using the revised version. 30 were deemed to be non-schizophrenic, according to the revised version of the DSM, therefore showing that they had been misdiagnosed. Upon re-diagnosis, a single-blind technique was used whereby the psychiatrist was blind to the hypothesis. How well the patients could function in everyday life was measured by looking at marital status, occupational status, peer relationships, isolation, and interests. The course and severity of the illness was measured by looking at the number of times the patient had been in hospital and how long the hospital stays had been over a 10-year period. Results: schizophrenic women had a significantly lower number of rehospitalizations. The average was 1.1 over 10 years, and shorter length of hospital stays, an average of 207 days over 10 years. Men had a rehospitalization rate of 2.2 over 10 years, with 418 days in hospital on average over the period of 10 years. The differences in gender was even stronger when looking at a 5-year period, possibly because the severity of schizophrenia does not worsen after 5 years. Differences in pre-morbid functioning before diagnosis, such as isolation, peer relationships, and interests, affected rehospitalizations were found. Social functioning affected the length of stays. Conclusion: gender differences in the course of schizophrenia are present in the early stages of the disorder, with poorer pre-morbid functioning in men being responsible for a poorer outcome. Her study reinforced what other studies had found, supporting her hypothesis that women had a less severe experience with schizophrenia than men. This was backed up in her study by the fact that men had more rehospitalizations and longer stays on average. She also found that the DSM-3 was a reliable tool for diagnosis, but noted that there were some misdiagnostic differences. 169 of the 199 patients were re-diagnosed with the same disorder. She concluded that pre-morbid functioning and social functioning are important factors in the development of schizophrenia. Evaluation. Strengths. The secondary data based on number of rehospitalizations and average length of stay are quantifiable, and so scientific conclusions can be drawn and are also both valid as they come from real hospital records and objective because they require no individual interpretation. Goldstein could show that her schizophrenia diagnoses were reliable as they were supported by 2 experts who found the same diagnoses as her. Despite one small disagreement of the 8 cases, inter-rater reliability was evident. By using interviews, she was able to gather rich and detailed qualitative data as well as the quantitative data. So all the information about pre-morbid history and social functioning, among other factors, were detailed to enhance the conclusions and ensure validity. Another study carried out in Germany, Angermeyer et al. 1987, had the same findings. Weaknesses. Of women who are diagnosed with schizophrenia in the country, only 9% are over the age of 45, yet no women aged 45 or above were included in the study sample, which may have affected the results and conclusions because women over 45 tend to experience a more severe course of the disorder than those under 45. So the findings may not be as valid as previously thought, as the statistics for men and women, cannot be applied to women. Goldstein used mainly white middle-class people from one area within the U.S., and the sample size of 90 was fairly small, so the findings may not be generalizable to all populations and all schizophrenics. There may have been interviewer bias when Goldstein conducted the interviews.